Now, as Director General has said yesterday that we may reconvene emergency committee at a very short notice. Director General recognized that this is clearly an emergency in China, and there is a high risk of further spread. But there were different opinions in emergency committee, and obviously they may meet again as situation develops.
So, Tarik, one consideration has been that there hasn't been evidence yet of human-to-human transmission outside of China so far. But if we wait until then, wouldn't it be like closing the barn door after the horse has bolted?
No, that's not correct. There are a number of considerations that are being looked at and different opinions. We know that there is a human-to-human transmission, and we have seen cluster of cases around close contacts around people who have been infected. We are likely to see more cases. In any case, as we step up surveillance, what we want really is two things. First, we want all countries to be on alert. We want health systems to raise their level of preparedness so they can quickly detect sick people. They can diagnose them and test them, and they can provide medical care. We also want population to be following the advice from public health authorities. And for the time being, we are giving the advice that is usually being given for respiratory illnesses. And at the same time, we need to understand the virus better. We know it's a coronavirus, so we know that there is a human-to-human transmission among close contacts. We also know that if we look at the MERS, that severity can go from mild to severe cases. And this is what we are really looking at now, to understand exactly how easily it's being transmitted, also what's exact severity, and at the same time we have to see what is the source. But there are many things we know, and we know that what is important really is that population does precautionary measures such as hand hygiene, such as avoiding contact with people with the flu-like symptoms, such as avoiding contact with live animals in the market, and especially to not travel if they feel sick, but rather to look for the medical care.
Well, you mentioned there a lot about the coronavirus, the source not to travel, listen to authorities. But do you think enough information about the virus is being shared by China? Are you getting enough information from China?
Well, China was very quick in identifying this virus. From the first reports that emerged on 31st December, it took only around 10 days to identify the virus, and what's more important, to immediately share the genetic sequence of the virus with WHO and with all other countries. This helped other countries basically to be able to test other people. We know that China is doing a lot of measures that they seem appropriate to contain the virus, and they are working with us. We had a team of people with them in Wuhan a couple of days ago to try and really to answer those questions that I already mentioned about the source, about severity, about transmissibility.
So, Tarik, the committee weighing the decision was divided, almost 50-50 as we understand it. That's according to the chairman. What were the issues of contention? Can you share that?
Well, I was not personally listening to the debate. I was answering journalists' queries. But really, what the committee is looking is risk of international spread, what containment measures need to be put in place, what are the characteristics of the virus. So some committee members probably thought that we need to get a little bit more information to understand exactly those things that we still don't know, and we need to see what exactly countries need and still lacking in terms of preparedness. But again, the fact of declaring public health emergency of national concern or not declaring does not mean that WHO is not issuing already recommendations. On January 10th, so 10 days after the first reports, WHO has issued a set of guidance for health practitioners on how to detect new cases, how to treat people who are sick, how to reinforce infection prevention and control measures in the hospitals, and how to work on a risk communication. Now, I mentioned infection prevention and control measures in the hospitals because this is a really important point. We know that some of the infected people are health workers. We know from coronaviruses that health workers are at particular risks. For example, what we have seen in MERS, that there were a number of nosocomial infections in health facilities. And we need really to make sure that people working in health centers and in hospitals are implementing standard procedures when dealing with infectious pathogens, so we avoid health workers getting sick.
Well, one of those measures are quarantine measures. China, we know, is taking unprecedented quarantine measures. And the WHO chief said that he hopes that they will be effective and short. What's your assessment of those measures so far?
Well, exactly. As I already said, countries may introduce measures based on their assessment of the risk. And as Director General said, we hope that these measures will be effective and they will not last very long. You see, when you have an outbreak of a new virus, you are putting in place immediately two types of measures: containment measures and mitigation measures, meaning what I was already explaining, having health systems ready to detect and to respond to such an outbreak. Containment measures basically aim to reduce the risk of transmission. Now, it's always a difficult balance to strike between possible benefit for the population of those containment measures and eventual social disruptions. So countries may make their own analysis and introduce measures as they feel appropriate.
Thank you so much, Tarik, for speaking to us. We've been speaking there to Tarik Jasarevic, spokesman from the World Health Organization.